If you are over 60 and you take vitamin B12 every single day, I want you to pause for a moment and listen very carefully. Because what I'm about to tell you may explain why you still feel tired, foggy, dizzy, or why your hands and feet still go numb, even though you have been doing everything right. And I know this is frustrating. I hear the same question almost every week in my clinic. Doctor, I take B12 faithfully. Why am I still exhausted? Why is my memory getting worse? Why do I still feel tingling in my fingers? Why is my balance off? Just recently, a 68-year-old man asked me this exact question. He had been taking vitamin B12 for more than 7 years. His blood tests looked normal. His doctor told him, "Your B12 is fine." But his energy was declining. His balance felt unstable, and his memory was getting worse month after month. And what shocked him was this. He was not lacking vitamin B12, he was taking it the wrong way. And new research shows that one extremely common B12 mistake, especially in adults over 60, can block absorption and silently damage nerve function, even while your lab numbers look normal. I'm Dr. Emily Carter, and in today's video, I'm going to show you what that mistake is, why most doctors overlook it, and how to take vitamin B12 the correct way so it actually supports your brain, your nerves, your balance, and your long-term energy. And please stay with me until the end, because I'm also going to give you the exact B12 protocol I use with my own patients over 60, not vague advice, a clear, simple routine. Now, before we dive in, I want you to do something for me. Drop a comment with your age and where you're watching from today, and tell me one thing. Are you taking B12 but still feeling fatigue, brain fog, dizziness, or numbness? Write it below, because your experience helps this entire community. And if you want science-backed health strategies designed specifically for seniors, hit subscribe. I post new videos every week here on Dr. Emily Carter Senior Health. Now let's get into what most people do not understand. Most seniors believe this. If my blood test shows a normal B12 level, then everything must be fine. But after 60, that assumption is often wrong. Because vitamin B12 is not just an energy vitamin. Vitamin B12 is essential for nerve function, brain health, red blood cell production, and the protection of something called myelin. Myelin is the protective coating around your nerves, and when your nerves lose myelin, your body starts sending you warning signs. And those warning signs are often subtle at first. You may feel tingling in your hands, a slight numbness in your toes, a burning sensation in your feet. You may feel off balance when you walk. You may feel dizzy when you stand up. You may start forgetting words mid-sentence. You may feel mentally slower than you used to be. You may feel tired even after sleeping. And many seniors assume this is just aging. But very often, this is the nervous system struggling. And B12 is one of the most important nutrients your nervous system depends on. Here's the problem. As you get older, your ability to absorb vitamin B12 drops sharply. In fact, by the age of 60, more than half of adults have reduced stomach acid. And stomach acid is required to separate B12 from food and to help your body absorb it properly. Without enough stomach acid, B12 can pass through your body unused. And this is why so many seniors take B12 for years and feel absolutely no improvement. Now I want to tell you about one of my patients. Her name was Margaret. She was 71 years old. She came to me with burning sensations in her feet and frequent dizziness. Her doctor checked her B12. It came back normal. Her number was in the 400s, and she was told, nothing is wrong. But her symptoms continued to progress, and what Margaret did not realize is something most seniors do not realize. A standard blood B12 test does not show how much B12 is actually entering your cells. It only shows how much is floating in your bloodstream. And in older adults, B12 can appear normal on paper, while the nerves are still starving. This is the reason so many seniors are told they are fine, while they are slowly losing balance, losing memory, and losing nerve function. Now, this is where the first major mistake happens, and I want you to listen carefully because this mistake is extremely common. Most seniors take vitamin B12 as a standard tablet and swallow it with water. They assume it will be absorbed like any other vitamin. But after 60, that form often does not work. Because B12 absorption requires a protein called intrinsic factor. Intrinsic factor is produced in the stomach, and with age, intrinsic factor production often declines. So even if you swallow B12 faithfully, your body may absorb only a tiny amount. And this is not rare. It is extremely common. That 68-year-old patient I mentioned earlier was taking B12 exactly as instructed every morning. Same dose, same brand, same routine. Yet his nerves were still deteriorating. And when we changed one thing, not the dose, but the delivery method, his symptoms began improving within weeks. This is why the form of vitamin B12 matters just as much as the amount. And now I want to tell you the second mistake, because this one is even more common, and it's hiding in plain sight. Many people take the wrong form of B12. If you look at most B12 supplements on store shelves, you will see one name again and again: cyanocobalamin. It is cheap, it is stable, and for older adults, it is often the least effective form. Cyanocobalamin is a synthetic form of B12. Your body must convert it into active B12 before it can use it, and that conversion requires healthy liver function, proper enzyme activity, and adequate antioxidant capacity. But in adults over 60, that conversion process often slows down. I saw this with a patient named Robert. He was 72. He had been taking cyanocobalamin for years. His blood levels looked acceptable. But he continued to experience numbness in his fingers and difficulty walking. And when we switched him to methylcobalamin, an active form of B12, the change was noticeable. Within 1 month, his balance improved. Within 3 months, the numbness decreased significantly. And yes, research supports this. Active forms of B12, such as methylcobalamin and adenosylcobalamin, are absorbed and utilized more efficiently in older adults. Now let me pause here, because at this point, some of you may be thinking, "So, Dr. Carter, are you saying my supplement is useless?" Not necessarily, but I am saying this. If you are over 60 and you are taking B12 and you still have fatigue, brain fog, numbness, tingling, balance issues, then there is a very high chance you are not actually getting enough usable B12 into your nerve tissue. And now we come to the third mistake. And this one surprises almost everyone, because it has nothing to do with the dose and nothing to do with the form. It has to do with consistency. Many seniors take B12 only when they feel tired. They skip days, they stop when symptoms improve, then they restart weeks later. But nerve tissue does not heal that way. Vitamin B12 is not a stimulant, it is a repair nutrient. Your nerves require steady daily availability of B12 to rebuild damaged myelin. Intermittent dosing interrupts the repair process, and I saw this clearly in a 70-year-old woman named Elaine. Elaine took B12 only on days when she felt exhausted. On those days, she felt slightly better, but her numbness, her balance issues, and her memory problems never improved. When she began taking B12 consistently every day without skipping, her symptoms started to stabilize. After 2 months, the tingling stopped progressing. After 4 months, her balance improved. Now I want to tell you one more thing, because this is another mistake that seniors do not expect. Taking B12 at the wrong time of day. Many seniors take B12 late at night, and for some people, B12 can increase alertness, which can disrupt sleep. And poor sleep raises cortisol. It increases inflammation, and it slows nerve repair. So for most seniors, the best time to take B12 is in the morning or early afternoon. This supports energy and supports nerve function without disturbing sleep. Now, before I show you the exact protocol, I need to explain one more critical issue. And this is the part that most doctors do not talk about at all: medications. Many seniors take medications that interfere with B12 absorption or function. And I want to be very clear. This does not mean you should stop your medications, but it does mean you must be smarter about B12 support. Some common medications that reduce B12 absorption include acid blockers, metformin, and certain long-term antibiotic use. If you are taking any of these, your risk of B12 problems is significantly higher. And this is one reason why so many seniors take B12 and still feel symptoms, because the medication is blocking absorption, and nobody explains it. Now here is the truth. Most seniors are not doing one thing wrong. They are doing several small things wrong at the same time. Each mistake reduces the benefit slightly, but together, they can completely cancel out the effect of vitamin B12. And that is why you feel like B12 does nothing. Now, by this point, you may be realizing something important. Most seniors who take vitamin B12 are not doing just one thing wrong. They are doing multiple small things wrong at the same time. And each mistake reduces absorption a little. Then another mistake reduces utilization a little more. And another mistake interrupts nerve repair. And before you know it, you've been taking B12 for years, and your nerves are still starving. Your brain is still under-supported, and you still feel tired, foggy, dizzy, or numb. So now, let me walk you through the correct vitamin B12 protocol for seniors. This is the exact approach I use with my own patients over 60, and I'm going to keep it simple, because you do not need complicated supplement stacks. You need the right form, the right delivery method, the right dose, and the right consistency. Let's start with the most important part, the form. For most seniors, the best choices are methylcobalamin, or a combination of methylcobalamin and adenosylcobalamin. These are active forms of B12. That means your body can use them immediately, without needing to convert them. And this matters tremendously after 60, because conversion slows down, liver function changes, and oxidative stress increases. Now, what about cyanocobalamin? Cyanocobalamin is not poison, but it is often the weakest choice for older adults, especially if you already have symptoms like tingling, numbness, balance issues, brain fog, or memory problems. If you have those symptoms, you want the form your nervous system can use right now, not the form your body has to struggle to convert. Now let's talk about delivery method, because this is the mistake that keeps seniors stuck for years. If you are over 60, swallowing a standard B12 tablet is often not enough. And here is why. Your stomach acid is lower, intrinsic factor is lower, and your digestive system is slower. So the B12 goes into your stomach, and much of it simply passes through. This is why I strongly prefer sublingual B12 for seniors. Sublingual means you place it under your tongue and allow it to dissolve slowly. This helps bypass many stomach-related absorption problems, because some of it can be absorbed through the tissues in the mouth. Now, is sublingual perfect? No, but for many seniors, it is dramatically more effective than swallowing a pill. Now let's talk about dose, and I know this is where people get nervous, because seniors are often taught, more is dangerous. But vitamin B12 is not like vitamin A. It is not like iron. It is not like certain fat-soluble vitamins. Vitamin B12 is water-soluble. That means your body takes what it can use, and the rest is safely excreted. So when it comes to older adults, low doses often fail. Because you are not dealing with a lack of B12, you are dealing with poor absorption. So you need a dose that can overcome that barrier. For most seniors, a common effective range is 1,000 to 2,000 micrograms daily. And for some people, especially those with nerve symptoms, the initial dose may need to be higher for a short period before dropping down to a maintenance dose. Now I want to say something clearly. I am not telling you to self-treat serious neurological symptoms. If you have severe numbness, worsening balance, or weakness, you must be evaluated by a medical professional. But if you are taking B12 already and you still have mild to moderate symptoms, this protocol is often a major turning point. Now let's talk about consistency. This is the part where many seniors sabotage themselves without realizing it. B12 must be taken every day, not occasionally, not only when you feel tired, not 3 days a week, every day. Because nerve repair is slow, and nerve tissue heals best when it has steady support. Think of it like rebuilding a damaged road. You cannot repair the road one day, then stop for 2 weeks, then repair it again. The road stays broken. Your nerves work the same way, and this is why seniors who take B12 inconsistently often get no improvement. Now, timing. For most seniors, the best time to take B12 is in the morning or early afternoon, because B12 can increase alertness, and if you take it late at night, it may interfere with sleep. And sleep is one of the most important things your nervous system needs to heal. If your sleep is poor, your inflammation rises, your cortisol rises, and your nerve repair slows down. Now, there is one more detail most people miss: hydration. And I know this sounds too simple, but it matters. Vitamin B12 works inside cells, and your cells rely on fluid balance. Chronic mild dehydration, which is extremely common in older adults, reduces nutrient transport into nerve tissue. So if you are taking B12, but you barely drink water, your results will be limited. Now, let's talk about supportive nutrients, because B12 does not work alone. And this is another reason why seniors take B12 and still feel symptoms. B12 is part of a system. It works closely with folate and vitamin B6. These nutrients support methylation, red blood cell function, and nerve chemistry. Now, I want to add an important caution here. Many seniors take high-dose folic acid, and in some cases, high-dose folic acid can mask B12 deficiency symptoms while nerve damage continues. So if you use folate, I generally prefer natural folate or methylfolate rather than high-dose synthetic folic acid. Now, at this point, you may be thinking, okay, Dr. Carter, so if I do all of this correctly, how will I know it's working? Great question, because this is where seniors get misled. Most people judge success only by blood tests, but as I explained earlier, a standard B12 blood test is not the full picture. It does not show what is happening inside your cells. So instead, you should monitor your symptoms. Ask yourself, are my hands less numb? Is my balance improving? Is my thinking clearer? Am I less dizzy? Do I feel more stable when I walk? Do I have more energy? These changes matter more than a number on a lab report. I had a patient in her mid-70s who followed this protocol. After 3 months, her lab values changed only slightly, but her walking improved, her falls stopped, and her confidence returned. That is real success. Now, I need to say something very important. Vitamin B12 is powerful, but it is not magic. And there are situations where B12 alone will not fully resolve symptoms. One of the most common issues is long-standing nerve damage. If nerve compression, spinal degeneration, or diabetes has been present for many years. B12 can support repair, but it cannot reverse severe structural damage overnight. Another overlooked factor is blood sugar. High blood sugar damages nerves directly. So in seniors with prediabetes or diabetes, nerve symptoms may persist unless glucose is addressed. Inflammation is another silent blocker. Chronic inflammation interferes with nerve signaling and nutrient delivery. Poor sleep, chronic stress, and sedentary habits all increase inflammation. So if these issues are ignored, B12 works harder and delivers less benefit. And finally, there is the issue of misdiagnosis. Not all tingling, not all numbness, and not all weakness is caused by B12 problems. Conditions like cervical spine compression, carpal tunnel syndrome, peripheral neuropathy from other causes. These can mimic B12-related symptoms. This is why persistent or worsening symptoms should always be evaluated. Do not assume that more supplements will solve everything. Now, I want to share a quick example. A 73-year-old man came to me frustrated. He had doubled his B12 dose on his own, after reading online advice, but his symptoms did not improve. Further evaluation revealed spinal stenosis. His nerves were being physically compressed. No amount of B12 could fix that. Once the correct diagnosis was made and proper treatment started, his B12 supplementation became supportive instead of disappointing. Now let's bring everything together into a clear action plan, because I want you to leave this video knowing exactly what to do. If you are over 60 and you are taking vitamin B12, this is what matters most. First, stop focusing only on lab numbers. A normal B12 blood level does not guarantee healthy nerves or brain function. Second, use the right form. Choose methylcobalamin or methylcobalamin plus adenosylcobalamin. Third, use the right delivery method. If you are over 60, do not rely only on swallowed tablets. Use sublingual B12. Fourth, take an effective dose. For most seniors, 1,000 to 2,000 micrograms daily is a reasonable starting range. Fifth, be consistent. Take it every day. Nerve repair is slow and steady. Skipping doses interrupts progress. Sixth, take it at the right time. Morning or early afternoon is best for most people. Seventh, support the process. Hydration, blood sugar control, sleep, stress. These determine whether B12 can actually reach your nerves and brain. Eighth, know when to look deeper. If symptoms continue to worsen, do not assume B12 is the only answer. Seek evaluation. Now, before we end, I want to leave you with one final thought. A woman in her early 70s came to see me after years of believing B12 simply did not work for her. And when we reviewed her routine, nothing she was doing was technically wrong, but nothing was being done correctly either. She was using the wrong form, swallowing a tablet her body could not absorb, taking it inconsistently, judging success only by lab numbers. She changed just a few things: the form, the delivery method, the consistency. 3 months later, she told me something I will never forget. She said, "I feel steady again. I trust my feet when I walk. I don't lose words mid-sentence anymore." That is the difference between taking a supplement and using it correctly. If you are over 60, vitamin B12 is not optional. But how you take it matters more than most people realize. Tonight, I want you to look at your current B12 routine and ask yourself one simple question. Is this actually supporting my nerves and brain? Or am I just checking a box? Before you go, comment below with your age and where you're watching from. Tell me what form of B12 you are taking and what changes you plan to make. I read every comment, and I love hearing from this community. If this video helped you, share it with someone you care about, because many seniors are taking vitamin B12 the wrong way, and they do not know it. Thanks for watching, and don't forget to subscribe for more life-changing senior health tips. I'm Dr. Emily Carter. Stay strong, stay healthy, and I'll see you in the next video.